Welcome. I'm Dr. Lauren Streicher, and welcome to this Facebook Live. I'm so excited to be joined today by the amazing Kim Vopni, otherwise known as the Vagina Coach, who we actually met on Clubhouse, of all places. I've met some interesting people on Clubhouse, and we found that we were always the ones in the room talking about the same thing and chiming in and interrupting each other. So we thought, okay, it's time that we have an actual conversation where it's just the two of us instead of whoever else decided to chime in as well. So welcome, Kim. And before we move forward with today's topic, just take a minute and tell us who you are and what you do.
Yeah, thank you, Dr. Streicher. It's really a pleasure to, again, chat with you one-on-one now instead of us being in the room and going back and forth. But as you said, my name is Kim Vopni. I'm the Vagina Coach, and I got into this line of work really through my own fear and fascination of pregnancy and childbirth, and kind of wondering how giant babies came out of vaginas and people were able to carry on with all the things they wanted to do. And so my pelvic health journey has become part of really my life's work. And I started out with an e-commerce store selling pelvic health products, one of which was one that I had used in my pregnancy. And that's kind of how it started. It wasn't really actually supposed to be a business at the start. It was really just kind of word of mouth selling this one product that I had learned about from my midwives. And then it started to morph into more. I started networking and learning about pelvic health physio, which is something that at the time I didn't know anything about, but started to shout from the rooftops about it afterwards. And having a background in fitness, I started to specialize as a personal trainer in pre-postnatal. So initially with pregnant women and people. Then it transitioned into a second business, helping optimize postpartum recovery and bringing in traditional practices from mother roasting that are used around the world. So I manufactured a postpartum wrap with an exercise program. And then as I was going through different life stages, now starting to work with perimenopause and menopause women and recognizing that the topic of pelvic health really is something that needs to be addressed through all life stages.
Yeah.
And so that's what I do is I work with women through all life stages.
But I think the thing that we both talk about so often is the fact that so few women even know that pelvic floor health exists, that there are people who can help. And I once did a survey. I do a lot of fun surveys. And I once did a survey that, basically I surveyed thousands of women and said, have you ever heard of pelvic floor physical therapy, personal trainer for your vagina? And 80% of people said, are you kidding? I have no idea what you're talking about. And even today, as you know, I'm the medical director of the Center for Sexual Medicine and the Center for Menopause in Chicago. And we, of course, have wonderful, wonderful pelvic floor physical therapists. We are so lucky. They are physically in the center, so we refer everyone to them. And whenever I refer someone, I always start by saying, now, are you familiar with pelvic floor physical therapy? And my patients are smart. These are women who are educated, who are savvy, who have come to me on their own because no one else has been able to help them with their problem. And I always expect them to say, well, of course I do. And 90% of the time they say, what? What are you talking about? And then when I tell them, they're kind of like, skeptical would be the understatement. And then, of course, as you and I well know, by the time they go through the therapy, they are the greatest, the advocates, and they want to shout it from the roof as well. So, but the topic that I wanted to talk about specifically today is something that I think it's so important, is why treatment fails. Because so often you will have a woman who goes to her doctor, and as you said, it doesn't matter whether it's postpartum or postmenopause or whatever is, started the situation, and they are having pain with any kind of penetrative sex. And just I always say, even though I'm talking about intercourse, it's not necessarily with the penis, it could be with the toy, whatever. It's the idea of something going in the vagina is making your vagina go, oh my God, stop, it's painful. So a lot of times they'll go to their doctor, they'll get a treatment, they go home, they do the treatment, whatever it is, or whatever the doctor recommended, and they're still having pain. And all too often, what the woman thinks is, I'm just a hopeless case. I went to my doctor, he or she told me what to do, and it didn't work, and they give up. And I think that's where you and I come in. So before I turn it back over to you, I'm going to talk about the top 3 reasons why women continue to have pain after they've been treated. Reason number 1, the wrong thing is being treated. I cannot tell you how often someone will go to a doctor and say, it's dry, it hurts, I'm having pain. And that doctor may treat them thinking, well, this is vaginal dryness from postpartum or vaginal dryness from peri or postmenopause. And in fact, they have a completely different condition that either they weren't examined properly or it just wasn't diagnosed. So even if they're given the right treatment for the wrong thing, it's obviously not going to work. So that's number one. Number two is inadequate treatment. Someone might be told, okay, use a lubricant. Well, maybe a lubricant isn't going to help them because a lubricant doesn't change the tissue, it just makes it more slippery, and they might need a prescription product that's actually going to change the tissue. But then we get to number three, and number three is the big one. And of course, Kim, that's where you come in, is that we eliminate the cause of the initial pain, whether, it doesn't matter what it is, endometriosis, from pregnancy and delivery, from menopause and dryness. We get rid of the pain, but sex is still painful because the muscle memory is still there, and those muscles are saying, don't come in here. We remember the pain. So Kim, could you just kind of go through briefly and explain the role of the pelvic floor muscles in allowing comfortable penetrative sex?
Yeah, and I agree with the reasons that you have said, and also with the results of your survey. So many people have no idea what a pelvic health physio is, and I actually personally recommend pelvic health physical therapy as the first line of defense, actually, because I feel like you get a more comprehensive evaluation of the pelvic floor, and if it is a medical reason, they can refer on. But I find that not often are medical doctors referring on to pelvic health physio, except for people who have, again, collaborative environments like yourself. But so the muscles it's a group of muscles. They have very important functions in the body. Sometimes we hold on to tension, and it can be a bit of a, chicken and egg scenario where tension may have developed, which contributed to pain, which then contributes to more tension because there's maybe fear or apprehension. And so it can sometimes, it's like a biopsychosocial approach. We have to address all of the contributing factors. So muscles are designed to move through a range of motion, and that includes the pelvic floor. So the pelvic floor muscles have a kind of a closing element, a lift element, and a let go. And for people who may have been, or maybe even now, experiencing things like leakage, so urinary leakage, even anal, bowel or gas, or if they have prolapse, so they feel like something's potentially going to fall out, or if they're nervous about their partner feeling or seeing something, they may have been guarding. So they may have some tension. They may not have their muscles are not moving through the range of motion. And part of penetrative sex requires a relaxation, like an allowing to happen to accommodate something coming in. And if those muscles are apprehensive, or if you're apprehensive, that tension will be there and could be prohibitive or make it more uncomfortable. So releasing that tension is really, really important. But again, also addressing what's contributed to that. Is it fear? Is it trauma? Is it a fall that's maybe jarred the muscles and they're working in an imbalanced way? Is it scar tissue from surgery or childbirth? So there's lots of different contributing factors. And in terms of the treatment or things that I recommend, pelvic health physical therapy, of course, there's lots of manual therapy that they can be doing. There's self-treatment.
And just to be clear, because a lot of people don't realize this, it's external therapy, but it's also internal therapy. A pelvic floor physical therapist will be putting her fingers in the vagina. They also treat men, of course, not in my clinic, but when they treat men, people are always curious, well, what do they do then? Well, they go right through the rectum, But people don't appreciate the fact that this is hands-on therapy, which is a little off-putting at first, but it's really surprisingly comfortable. I mean, they do the physical therapists we work with do such a great job of putting people at ease.
Yeah. Well, so many people interpret it as like, they think the only thing they've ever maybe experienced similarly could be a PAP, and nobody really loves a PAP, and speculum, there's no speculums with pelvic health physio. It's it's gloved fingers. It's they educate and talk you through the entire thing. They will only go internal if they have your consent. And it is like, so many people walk away saying, how is it that I've lived for 35, 45 hours, 75 years in this body? I've given birth, I've had sex, I've done all these things, and I didn't know this about my body. I had no idea this. So they come away with this incredible knowledge and sense of power and control that they never had before.
Well, that's so true. And it's the education aspect is enormous because a lot of women might go to a physical therapist because of painful sex and then learn that, oh my God, this is why I'm constipated. This
Yes.
is why I'm losing urine. This is why all these other things are happening because the crossover is enormous. The other thing also that you kind of touched on that I wanted to emphasize is so many people think that when they go to see a physical therapist, they're going because they want to make the muscles stronger. That's what's in their head. You got to go in because that's what happens if you injure your hip or your arm or whatever. You are trying to take weak muscles and make them strong. But Kim, the thing that you said that is so critical when it comes to comfortable intercourse is we're not trying to make those muscles strong. We're trying to make them relax. It's because they're tight. They're in defense mode. They're in do not come in mode. That people are having the problem, that people are having the pain, which is most extreme is something called vaginismus, where they literally, nothing goes in. I mean, it's not even that it's painful. It will not go in. And there's nothing worse than when women are told this is psychological. It makes me crazy.
Go home
Have a
and have
glass
a glass
of
of
wine.
wine. Yeah.
Oh, yeah. I mean, I tell people we have a lot of drunk women who are still going to have painful sex. There's actually, I have a lecture that I give, an academic lecture, that I literally have photos on my PowerPoint slides of, women drinking and falling out of their bathtub from being told, take a bath, drink, that's not going to help. It's not going to help. They have to get therapy that is going to use all these modalities that you touched on and biofeedback. But the other thing I want to talk about, because you're not a physical therapist, you refer to physical therapists, and we always talk about how collaborative it is. And one of the things about physical therapy is the best of physical therapy, it's time limited. So you can't just do your physical therapy for 12 weeks and expect to be cured for life. It's kind of like saying I went to the gym for 12 weeks and my arms got strong and now I'm done with that. You're going to have mushy arms, 6 months later. So a lot of what you do and what you bring to the table is not only working collaborative with physical therapists, but it's the bigger picture.
Yes.
It's, long term. So what I'd like you to talk about a little bit, because this is so critically important, is first of all, what to do at home and that, you can offer that you don't need a physical therapist for. And also, let's just be honest that while you and I both agree that in a perfect world, the first line for any woman who's having painful intercourse, pelvic pain, incontinence, and all that is to see a pelvic floor physical therapist. But that's just not going to happen for a lot of women. Their insurance may not cover it. They may not have access. They may not have the time to go. There are a lot of reasons why realistically it's not going to happen. So Kim, tell us what you can offer to help those women who just are not going to be able to have access to a pelvic floor physical therapist.
Yeah. And even if you do, so whether you do or don't, this is what I do is meant to complement the work done or to be I don't want to say replacement, but something that is the next best thing, I guess you could say. And as you said, we don't just go and do an arm workout for 6 months and get stronger arms and then stop for the rest of our life because we now have strong arms. We have muscles in our body that benefit from movement. And in order for the pelvic floor to be responsive, meaning having the capacity to relax when needed, having the capacity to contract or close and lift when needed, we need to train it that way. And we right now, most people may have heard, so they haven't heard of pelvic floor physio, but they will most likely have heard of Kegel exercises. And so Kegels are a form of pelvic floor exercise, but there's many different types of pelvic floor exercise. They're a component of it. And we even have research to show most people are doing them incorrectly. So Kegels are prescribed very regularly, especially if you go to your doctor with regards to something to do with incontinence, painful sex, pelvic floor, anything, they'll say, are you doing make sure you do your Kegels. But nobody's evaluating the pelvic floor. Nobody's teaching. They may give you a pamphlet, but we know that is not enough. We need visualization. We benefit from potentially somebody, if we have access to a physio, to help teach us. But there's lots of ways to see or feel what's happening by visualization. So I have a video called the Core Breath, which walks you through visualization. We can use our own biofeedback, which is our fingers. If we have a partner's fingers or penis. And what a Kegel is there's a closure. So there's an element of coming together, of a gentle lift and then a let go. And when we learn how to do that and then take it one step further, which is bring it into movement. So I do a full whole body approach that works on relaxation. So learning to let go in muscles that may be overactive. Hamstrings are one, posterior pelvic floor, glutes are really big ones typically. So working on releasing that tension. And then learning how to activate the pelvic floor and bring it into movements that are things we do, like squats or lunges or even bicep curls or deadlifts, like functional movement, but also movements that you do if you're in a workout at a boot camp in the gym. So when you know how to harness your pelvic floor and bring it into those movements, you're getting the benefit of pelvic floor exercise. You're getting the benefit of it being dynamic, not just static, where you're sitting in a chair or brushing your teeth or doing your Kegels at every red light. You need to do it dynamically because life happens standing up. And that's typically when things like leaking or incontinence will happen. And then once you've learned how to do all of that, you then do it on a daily basis. And it may only take 5 or 10 minutes. It's not like you have to do a whole extra hour of pelvic health. Bring it into the workout that you're already doing. And then the final thing, there's an exercise technique called the hypopressive method. And this is a series of postures that are considered to be low pressure, meaning they don't contribute to a lot of increases in intra-abdominal pressure. And those increases can sometimes contribute to prolapse or incontinence. And when we are in postures that don't contribute to a rise in it, and then add a breathing technique that we do something called an apnea, where there's a bit of a breath hold that happens to create an involuntary response that is like a drawing in and a lifting up of the viscera and the abdominal wall. So it's really, really beneficial for incontinence and prolapse. So what it does is it trains the involuntary aspect of the core, whereas Kegels are voluntary. We're asking the pelvic floor to contract and lift. In hypopressives, it does it automatically, and it is down regulating, meaning people who have overactivity in the muscles, which is a big contributor to pain with sex, there's a normalizing of tone. And so people, even like, it can happen immediately. So somebody who's just like, I can't relax, they can do one apnea, one hypopressive breath cycle, and immediately the pelvic floor can release. It's remarkable. So that is something that I incorporate with pretty much, I'd say like 95%. It's not suitable for people who are pregnant or people with high blood pressure, but anybody else, regardless of age, it's really, really beneficial for helping get that tone down.
So I'm assuming that everything that you just told us about is in your book, correct?
It is.
It is. Here's your book. Here's Kim's book, which, I mean, you just gave us so much good information. And a lot of this stuff, you need to visualize. You need pictures. That helps. I have all kinds of videos and 3D images on my website as well, drstreicher.com, because you have to see this stuff. But the other thing is, and you kind of skimmed over quickly, but it is so critically important to say that the majority of women do their Kegels and they do not do them correctly. They do not do them consistently. And that's why they don't work. And I can't tell you how many times I've given a live lecture and I'll say, raise your hand if you do Kegels, and every hand goes up. And I'll say, keep your hand up if they worked, and every hand goes down. And again, yet another example of why treatment fails. It's not that Kegels were the wrong thing to do, it's that they need to be done correctly. Now, the other thing that I recommend, in addition to everything that you said, in terms of how do you know that you're doing Kegels correctly, because it all comes down to biofeedback, which is basically, letting you know if you are in fact contracting those muscles and the right muscles and holding them. So I don't know if you're familiar with ATTAIN, if you're familiar with this device. So ATTAIN is, I think, a really nice adjunct to pelvic floor physical therapy and training and all of that, because with ATTAIN, here, I'll show you where that is. ATTAIN is an over-the-counter device. InControlMedical.com is the website. I do work with the company. I always give that disclosure. But this is a device that you could use at home, that the idea is it doesn't replace a pelvic floor physical therapist, but it's either if you can't get to one or it's used in conjunction. And for maintenance therapy, it's really, really helpful in terms of letting you know if you are doing your Kegels correctly. In addition to ATTAIN, actually does a little bit of e-stim, where it actually gets the muscle to passively contract and relax, which helps the muscle do what it's supposed to do. So it's really one of those nice devices, which is an adjunct to everything else we're talking about. Now, a comment did come in, and if you want to ask any questions or comments, you can put them right there in the Facebook feed, and we will be able to see them. This is from Christine, who's 44 and has had the whole laundry list of things that can cause problems: fibroids, endometriosis, abnormal bleeding. She had a hysterectomy. She has a prolapse of her rectum, a rectocele. I mean, Christine, you are, the poster child for everything that we are talking about. And one of the things that I think is also so important when, Christine, we're talking to someone like you who has such a complex pelvic floor is, where do you start? Where do you get help with this stuff? Because it can be really overwhelming. And even which specialist do you go to? A lot of people think, okay, my gynecologist is the best person. Not necessarily. If you have a prolapse, if you have a rectocele, which is a pouching out of the rectum, if you have a cystocele, which is a dropped bladder, incontinence, whether it's urinary incontinence or stool incontinence, sometimes the best person to see is a urogynecologist, which is a specialty of gynecology that they do additional training in pelvic floor. And yes, they are surgeons, but they will also help point you to a lot of non-surgical options. The other thing also that I think it's worth spending a minute on is Kim and I, before we went live, we talked about where we send people to find a pelvic floor physical therapist. Because, in my center, I mentioned I'm lucky enough to have a staff of pelvic floor physical therapists, but we see people from all over the country. A lot of times someone will come to me from, Wyoming or California or wherever, and they'll come to the center and will say, you need pelvic floor physical therapy. This is a weekly thing. Obviously, you're not going to come back and forth. So we try and help them find someone closer to home. So we have two sites that are worth going to find a pelvic floor physical therapist. One is pelvicrehabcom, which is a site that is specifically for pelvic floor physical therapists who have completed a particular course of study, the Herman Wallace study, and you're pretty much guaranteed that if you get someone on this list, they're going to know what they're doing. I always say when you go to your local, club or whatever, and they say, oh yeah, we have physical therapists. Well, if they're doing elbows on Monday and hips on Tuesday and vaginas on Wednesday, that's not the person you want to see. You want to see someone who's dedicated. And pelvicrehab.com, you will find someone who's dedicated. And then Kim, tell us about your go-to, which is pelvicguru.com.
Yeah, pelvicguru.com was started by a physical therapist she's in Orlando. And she has her own practice, but she started this as she was creating a resource site. And there's a directory on there that is pelvic health professionals across the globe. There's doctors, there's physical therapists, there's fitness professionals. So anybody who is specializing in pelvic health, you can go and search on there. So it's a really, really comprehensive site. There's also the physical therapy associations of your country or potentially state or province. If you're in Canada, there's also pelvichealthsolutions.ca is in Canada, if anybody's listening from Canada. And but two things I wanted to say just in reference to what you'd mentioned earlier with the ATTAIN, any other devices. What can be good about those is, again, they don't replace a pelvic floor physio, but they can be a motivator. They can be something that encourages people or reminds people or helps people be consistent. So my 3C approach is you have to do them correctly, you have to do them consistently, and you have to do them coordinated with movement. So I like the devices, but again, I want to get you using your pelvic floor in movement afterwards.
Absolutely.
And for Christine, who just who made a comment, I've dealt with adenomyosis. I've had a rectocele. I've had a uterine prolapse. So I completely understand the complexities of pelvic health and all the ins and outs and those, conditions like endometriosis, the pain conditions, even if they're not directly in the vagina, those, because they typically are centered around our menstrual cycle, they can directly influence the sensations, the tension, the sensations we have within our pelvic floor as well. And pelvic health physio can be helpful for that. They're not going to cure endometriosis, but they can help with the tension that is resulting from those types of conditions as well. And feel free to reach out. I have a lot of information about rectocele on my vaginacoach.com.
But Kim, this brings us back to what we've been talking about all along. This is a collaborative process.
Yeah.
It's okay. You're right. Pelvic floor physical therapy is not going to help with endometriosis. It helps with the pain and the muscle tension from endometriosis. But you also need to see someone who's an expert in endometriosis, who's going to calm down that inflammation, who's going to get rid of the pain. We have so many things available to us. I'm in the menopause world primarily right now because I run a menopause clinic, and people are like, do I just need to go to pelvic floor PT if I have dry, painful sex? No, we have to fix the tissue and the muscle both. So you need to work with me to fix the tissue and to restore normal elasticity and lubrication, whether that's from an over-the-counter or a prescription, of which we have lots and lots of information. And of course, my book that's out now, Slip Sliding Away, Turning Back the Clock on Your Vagina, is specifically about that topic. Yeah. But the idea is it's not just one person, it's more than one person. I also wanted to highlight, you just kind of threw out there the Canada thing. Can you are Canadian. Yes. You are joining us from Canada, which is one of the reasons I was so excited to meet you, because we all kind of get in our little, group, our little pods of people that we work with. And it's so exciting to work with someone who is from another country. I don't know if you know Marla Shapiro. She's another Canadian that we work with a lot in the menopause world. So I think that's so critically important, is that we use our resources everywhere, and Canada is not very far away. And I always point out when we talk about other resources, a lot of people, if they don't know where to go to find a menopause expert, and the place to go to find a menopause expert who can help with the vaginal dryness and lubrication and all of that, if you're not in Chicago and can't come see me. So you read my book first, Slip Sliding Away, Turning Back the Clock on Your Vagina. You read that first. And then if you need to find someone who can help you, then you go to the North American Menopause Society, which is menopause.org. But I want to point out, North American. It's not just U.S. Totally. And we have just as many clinicians and experts and people involved in NAMS is the acronym for it. We have just as many people involved in NAMS who are from Canada as the United States, which is one of the things that is so exciting.
Yeah, I always say it takes a village, and I think one thing that has really been highlighted during COVID, it was happening before that, but people were a little bit reluctant to pursue online or to be even searching online for help. But we were forced, our hand was forced during COVID. We could not see our in-person practitioners. So people were searching for other options. And I think indirectly, there's going to be a transformation of healthcare going forward. And there will be, I think, more people are recognizing now the importance of healthcare, not necessarily sick care. And they are looking to be proactive, and they are now seeing, okay, there are different practitioners who specialize in these elements. So the whole concept of a village, I think, is something that is emerging. And I'm hated COVID, but I'm certainly excited by some of the things that have happened with regards to healthcare and accessibility for people.
Mm-hmm. Yeah, I mean, I think that, and the remote thing is so interesting, because Slip Sliding Away is my third book. And when I did my first two books, it was, traditional publishers and traditional kind of launch. And I was out there doing book signings and lectures and all that, which was all great. And I love connecting with people in person. But having said that, doing things such as this, Instagram Live, Facebook Live, Zoom lectures, I am able to reach so many more people. We have a comment from Jean who says that she would like a more discreet forum. And Jean, I hear you. Because I know that a lot of the questions, I mean, face it, we're talking vaginas here. We're talking urine incontinence. We're talking painful sex. People don't necessarily want this on their Facebook page, and nor should they. So I truly understand that. And I'm trying to figure out a way that people can comment anonymously on this forum, so that we can get anonymous questions. And my technological skills are limited in that, but I do want to try and figure out a way.
People can do anonymous questions, but I mean, certainly you can email. I do a 30-minute free discovery call for people too, if they want any help. But I totally agree. Not everybody's comfortable. I of course, put this across the internet because I want people to at least know, but not everybody has the same comfort level. And I think that that's an important point to bring up, but feel free to email or reach out if you would like to ask a question, not in a private or in a public forum.
Yeah, no, it's really hard, because just by the nature of what we do, it is hard to have these conversations. And my husband is always laughing that, I talk about vaginas like other people talk about arms and legs, and I forget, that not everyone uses this language all the time. And to make it even worse, my daughter's a sex therapist, so you can only imagine the conversations at our table. But what's interesting though is because we have all these conversations and we're so open about it, my husband, who is not in medicine, he's a movie, producer and screenwriter and musician. And by the way, the music at the beginning and also at the end of this is written by him, just saying. But, he's very popular because all these men come up to him and say, you got to help me. You got to help me. And so we are actually launching a Facebook Live series called Men on Pause.
Yes.
Which we're launching, I think, a week from Saturday. We'll get that out there. And we're going to have, and it's really going to be for men and women to hopefully watch with the men in their lives. But it's really about saying, okay, guys, you need to understand this. You need to understand that the reason she's cleaning out the refrigerator at 2:00 in the morning isn't because she hates you. It's because sex hurts like hell and she's in avoidance mode. So we're kind of excited about. And the other thing also, just another quickie, is on my YouTube channel, which this is streaming on YouTube as well, of course, is on my YouTube channel. I do my analytics, and my number one video that gets watched is how to use a lubricant of all things. And I did the analytics, and it's almost 100% viewed by men. Yeah. So they want this information. They need this information.
Totally. I think that's a huge reason for marital breakdown, for relationship breakdown, is pelvic health. And because because if you get in avoidance mode, or if it hurts, or if you're avoiding it because you leak, or you're avoiding it because you have prolapse, but you're not talking about it openly with your partner, they feel unloved. They feel like you don't, and so the communication breaks down. But if people were, and I love what you're doing, because especially if couples will watch together, then there's an understanding, and the men, if you're in a hetero relationship, the men now understand what the women are going through, and there's ways to work together to resolve. So I love what you're doing. I think that's so important.
Well, I think the thing also, and thank you, but I think, like I said, the same to you, but I think the number one message that we have, and I, don't know you well, but from the little bit we've crossed paths, I think the number one message we have is, if you're not getting help, it doesn't mean there isn't help. Yeah. It's out there. Yeah. You just need to figure out, and it's sad that people kind of have to navigate their way through the medical system, but that's what we're trying to do by giving all of these resources about where do you find a physical therapist, where do you find a sex therapist, where do you find a menopause expert? Because yes, I provide all of those things at my center in Chicago, but most people, although we do a lot of virtual stuff, but I got to tell you, when it comes to painful sex, we must do an exam. We must. There are someone wants to talk about hot flashes. I can do that without an exam. Someone wants to talk about painful intercourse. Sorry, I got to do a very, very thorough exam, unlike any gynecologic exam you've ever had, because in addition to looking at a lot of things a general gynecologist doesn't look at, I am going to do an evaluation of your pelvic floor muscles, which more times than not is going to be at least part of the story, if not the whole story. Yeah. So I think that's the number one message, is if your own doctor, if your own clinician isn't helping you, there are resources. And I also do want to mention, and Kim, I think it's so great that you are able and willing to take people's questions and talk to them. I actually don't, because for me, it's a medical legal thing that because of malpractice issues, I can't give medical advice to someone who's not my patient. I'm always very careful to give medical information as opposed to medical advice. And I'm not able to answer individual questions for just that reason. So before we say goodbye, I want to say I have the same vulva puppet I noticed behind you. Next time I'm going to have my vulva puppet behind me too, because I think that again, it's normalizing this whole conversation. Right. So I want to thank you. This has been so great, and I really hope that we can do this again. And for those of you who are not following me on social media, because Kim, you're so much better at that than I am. I'm trying to boost my social media. So please look at me on social media and follow me on Instagram and Twitter and all that stuff, because that really does help me a lot in terms of getting this information out, which I'm trying to do. And then the last thing I want to mention is to please, while I don't want you to necessarily email me your specific questions, email me, message me topics. Tell me what you would like to hear about. I'm going to be doing these Facebook Lives pretty regularly, and I want to know what you want to hear. So, Kim, before we close, any last words that you would like to close with?
Well, thank you, first of all, for having me and for having the conversation. And for those that joined us, I appreciate you and sharing your vulnerability. And anybody who's listening afterwards, never give up. There's always an option, and keep searching. If you need to, reach out to me. I'm not providing medical advice, but I can help direct you to where you may need to go, or a resource that you may not have had before. And so vaginacoach.com is where you can find me and my programs. And again, I offer a 30-minute discovery call for anybody who's looking for just a safe place to talk and ask questions and get some guidance.
That. That's so nice. Thank you. Thank you. Thank you.
you.
And we tried this 12:30 slot to see how it works, but I'm beginning to think people don't want to talk about vaginas during lunch, especially if they're at work, because who knows? Who could be? So I think a lot of people are going to be listening to this later. Thank you. Please share it. We really appreciate it. And thank you. Thank you for, again, joining us and being so honest. So see you next time.